Good morning and welcome to today's webinar with one of our industry partners, Cardinal Health, on elevating your infusion center's inventory management strategy for improved patient care. The purpose of these industry partner webinars is to showcase our partners' services and solutions that can help take our infusion center membership to the next level in providing excellent patient care. Next slide. I'm Brian Nyquist, President and CEO for the National Infusion Center Association, and I'm pleased to say I'm joined by Veda Vadyar, Manager of Provider Solutions at Cardinal Health. Next slide. Before we get started, I want to just run through a few housekeeping items. First, you may submit your questions at any time during the presentation by clicking on the Q&A button at the bottom of your Zoom window. This webinar will be recorded and shared with attendees after the presentation. And finally, we will ask you to complete a brief 2-question poll upon exiting the webinar. Next slide. In terms of today's agenda, we will start with a brief introduction of NICA and Cardinal Health. We will highlight the applicable NICA standard for the proper storage, handling, and disposal of medications. Veda will run through strategies to enhance patient safety through optimized inventory management, and then we'll open it up to the audience for questions and answers. Next slide. For those of you not familiar with NICA, we are your nonprofit trade association whose sole purpose is to make sure your infusion center can stay in business and that you can continue treating patients with the highest quality care in a safe environment. And I'll hand it over to Veda for a Cardinal overview and to run through some stats from the American Medical Association. Take it away, Veda.
Sure. Thanks, Brian. And thank you, everyone, for being here today. Cardinal Health, as a distributor, prides itself on actively supporting non-hospital, community-based infusion centers. So our commitment goes beyond just providing purchasing power on infusion medications. We really offer a holistic range of solutions, which includes clinical expertise, practice management tools, technology solutions, with our goal not only to improve financial performance, but also really streamline operations. So infusion providers can continue delivering high-quality care. And because of that clear alignment, we understand the support that infusion practices needs. And Cardinal Health is always enthusiastic about partnering with NICA on informative webinars like this that can help us do that. So with that, on the next slide, I'd like to take a moment to just address kind of the elephant in the room. It is hard being an independent infusion center and practice today. It is not easy. It is extremely difficult. The landscape of physician practices has undergone a significant transformation in recent years. We actually have a study here by the American Medical Association that characterizes between 2012 and 2022, we've witnessed a real notable shift. The share of physicians in private practice has actually decreased by 13%, while those in practices partially owned by hospitals or health systems have increased by nearly 8%. And this trend really reflects the changing dynamics and partnerships that we see in the healthcare industry, highlighting the need for us to be a little bit more adaptable, for us to focus on strategic planning. And I think this is really why NICA and Cardinal Health are passionate on supporting infusion centers and how they need to navigate these challenges going forward. So in our next slide, you can also see how this is impacting our number one priority, which is patients. On average, physicians spend nearly 2 hours on paperwork for every 1 hour spent with patients. And we acknowledge that this is a startling ratio, honestly, a very broken ratio. This administrative burden not only impacts productivity, but also takes away valuable time away from patient care. So as we explore solutions and as we talk about topics today, it's crucial to keep these challenges in mind and work towards ways to make things more efficient, make things more streamlined. So with that, I'll actually hand it back to Brian to talk a little bit about NICA standards of excellence.
Thanks, Veda. In an effort to reduce disparities in quality of care and consumer safety, while supporting infusion providers' efforts to implement best practices and to help ensure patients are receiving high-quality infusion care in all care settings, NICA developed the first and only American national standards for the outpatient infusion industry recognized by the American National Standards Institute. Demonstrate your commitment to excellence by scanning this QR code to purchase a copy of the Standards of Excellence. As a reminder, our Infusion Center members get a discount on these standards, and our elite members get a complimentary digital copy. So access your copy today, scan that QR code to get started. Next slide. So per NICA standard 5.1, infusion centers are required to have policies and procedures in place for the proper storage, handling, and disposal of medications. The purpose of this standard is to ensure that all medications and components are stored in a safe and physically secured location, and that policies around inventory management take into account access, accountability, tracking, monitoring, record keeping, as well as security. Per this standard, inventory tracking must include monitoring lot numbers and expiration dates, and that medications that are expired or have exceeded their beyond use date are separated and quarantined in a designated area until proper disposal. Next slide. Now that we've laid the groundwork, I'll hand it back to Veda to run through the services and solutions Cardinal Health can offer to help you meet this important standard. Veda?
Perfect. Thank you, Brian. So let's talk a little bit about some key strategies and best practices when it comes to how you consider inventory management solutions for your practices. So when you think about inventory management, a lot of this is really evaluating your current state. So what current workflows do you have? What software capabilities do you use today? And does that actually meet your needs? So when we want an inventory solution, one of the main goals is to automate manual processes. It's to save time for your clinical staff. And what that could mean is integrating seamlessly with analytics or billing systems for streamlined operations. So I know many practices today that we partner with or that we see manually track inventory either on spreadsheets or they print out reports from an inventory software and they reconcile them with data in their accounting systems or their PMS systems to ensure everything is in order. But when we look at tools in the market today, some of them within Cardinal Health itself, there are tools that with very minimal effort, even without creating a lot of new integrations, which I know takes a considerable amount of time, could consolidate a lot of those dispensing activities with billing activities. So an area where you can see, hey, what drugs did I purchase? What did I actually dispense? Did I bill for it? And was it paid? And honestly, was I paid appropriately? Was this reimbursement accurate? So a lot of the time we do have systems and platforms that help with this. When we talk about prior auths, and please raise your hand if prior auths keep you up at night. It keeps me up at night. I can't see you all, but I'm sure your hands are raised. Prior authorization at this point in time is really not going anywhere, and the payer market has made that clear. So how do you navigate this for your practice, especially when we start thinking of specialty pharmacy and how we need to navigate that landscape? A lot of what we're thinking about is inventory from that perspective is a system that provides that last line of defense. You have alerts, notifications that let you know when a patient is scheduled or what is the right way to actually administer and dispense that drug to your patient. What insurance are they on? What health plan are they on? And then on top of it, are you actually in an area where you have an effective prior auth for that date? And that's really where we see a lot of the struggles for our practices. It's that disconnect where we don't actually have an active prior auth for a particular medication for a patient. And this gives you some reassurance that you are not at risk of dispensing an expensive drug that may compromise a lot of your reimbursement activities. I also truly believe inventory systems are meant to help you think less about the mundane activities in your practices so you can think critically around areas that are surrounding patient care. So systems that help create and generate purchase orders, draft purchase orders based on historical drug utilization and patient demand, based on your schedules that are upcoming for the next week or two, will significantly reduce the time you are spent calculating on how much inventory do you need to purchase, when do you need to purchase it, and really how do you minimize a lot of that carrying cost. We also see that the enablement of assigning medications in those specific areas where it needs to happen will certainly be a part or a capability of an inventory system that ensures that you're dispensing the right drug to the right patient without falling into reimbursement traps that could be an implication of a wrong serial number that was approved based on the payer. Again, when we're thinking less and focusing more on patient care, one area that we're really looking at, and one area we've actually created in terms of a capability for inventory is how do we use advanced logic capabilities to understand what are those smart dispensing suggestions at the time of dispense. So let's say I need to dispense 150 milligrams of a drug to a patient, and I have two 100 milligram vials and one 50 milligram vial. Instead of you doing calculations at that point of care, these platforms will start to suggest vial combinations to really minimize waste, but also effectively provide the patient with the correct dosage required for that treatment. Especially when you think of NDVs, what's already open, what's not. A lot of these systems are starting to be trained to intelligently tell you what should you dispense and when should you dispense it. And last but not least, insightful reporting capabilities will really help you understand and minimize costs. So whether it's your purchasing patterns, whether it is information on purchases versus reimbursement and how you need to stay financially viable, what payers are the most problematic based on your patient population, a lot of these analytics suites start to become your best friend, right? Because data will help you make informed decisions. So definitely an area where you have an inventory system that is complementary to analytics suites that help you get this information, that is going to save you a lot of time and energy. So if we go to the next slide, let's quickly talk about specialty pharmacy. I know it's a whole new world to navigate, and you're really dealing with high-cost medications to treat complex chronic care conditions. You're thinking about our traditional buy and build framework, and now you almost have to introduce pharmacy entities, different special handling, storage differences, administration differences, thinking of mail order aspects. But I think probably the biggest issue, and I've mentioned it a couple of times, is really that reimbursement process, insurance coverage, prior assistance, how to navigate those stark differences compared to our world of buy and bill. So we've seen a couple of ways to help mitigate problems downstreams with payers from an inventory perspective. A lot of the time, physically storing some of these medications separately will actually help. And when I say this, clearly defining and categorizing different types of inventory from site-owned, patient assist, clinical trial samples. You probably already do this, but it's worth actually thinking through, do I need to revamp my organization structure? Is there a way that I could provide more structure physically, but also something that ties back to your inventory system that helps you dynamically understand where your inventory is and what type of inventory you have. On top of it, utilizing clear labeling systems. So again, labels in inventory systems historically used to be very primitive. I think you would pretty much have the name, maybe the NDC. We're starting to see, GTINs, serial numbers, lot numbers, expiration dates, but also sometimes seeing patient names for pre-assigned inventory types. A lot of this will help you and provide that reassurance that you are, in fact, dispensing the right drug to the right patient. When we think about temperature monitoring, I think this is going to be extremely critical. And we've seen a lot of vendors in the market actually accelerate their roadmaps to support a lot of the needs for infusion centers. I think baseline and table stakes, you need to understand temperature alerts based on minimum, maximum thresholds, remote-based temperature monitoring. But we're starting to see the ability to customize multiple alerts based on different drugs to ensure that the storage condition risks across the spectrum of drugs that you may be handling are stored based on those guidelines. So again, figuring out what partner or what vendor can help you get to that space is going to be an evolution that is likely something you would need to take. and generally alerting capabilities in your inventory system. A lot of our practices use barcode scanning capabilities to alert you whether a medication, again, is pre-assigned or doesn't meet certain criteria. It gives them a hard stop or requires secondary override approvals by administrators to make sure there's that element of security. And then lastly, I'll just end with kind of two strong processes that we need to look at. One is regular inventory reconciliation checks. So inventory solutions today really should have this. Some products are more advanced than others. But again, I know a lot of practices are using tally sheets or spreadsheets. There are cycle count capabilities in our inventory solutions that can help with doing those reconciliation checks on a more frequent basis. Instead of doing it on a monthly basis, maybe moving to even daily or weekly to ensure that there are no discrepancies and you're avoiding problems as you go along. And complementary to that, really just understanding that there is going to need to be standard operating procedures that your clinical staff will have to leverage to avoid any confusion and provide consistency across patient care. And it really goes hand in hand. It's how do you use that technology to support your SOPs? And that is where we see the future of inventory management going. If we go to the next slide, when we're talking about inventory management, again, patient safety should remain top priority. And I think Brian mentioned this a little bit in terms of the standards of excellence, but implementing protocols to capture crucial medication details such as lot numbers, serial numbers, expiration dates are critical. I think everyone must know, DSCSA is really going to be enforced in November of this calendar year. A lot of that is really requirements both on the manufacturer side, distributor side, as well as providers to ensure that those data attributes are captured. And the goal is to remove the dual manual entry from one system to another and making sure that you minimize human errors by utilizing technology and a lot of those inventory solutions to automate that and to capture that information with maybe just a scan of a barcode. When we further think about implementing safeguards, again, alerting staffs when medications are nearing expiration and expired drugs. Again, what Brian mentioned, a lot of these inventory systems can do this today, ours included, to alert you that, is an expiration coming, is something expired. We need to really make sure that that is prominent to really focus on patient safety. And then furthermore, I think, again, from a security perspective, these are very expensive drugs. So securing high cost drugs is going to be a common practice now. A lot of you may already have remote locks, but if you don't, it's definitely a place where a lot of our solutions are starting to come out with hardware accessories that complement a lot of these infusion center workflows and their software capabilities. Definitely look for partners who are able to give you both. And then lastly, I'm sure everyone is acutely aware of what's going on in the industry when it comes to security, right? Change Healthcare has really impacted us as a whole. And I think it's imperative to ensure that any technology partner that you work with or will be working with, they have a security framework that will protect patient data through this entire process. That is going to be pivotal. And it's important that that's on your checklist when you're evaluating vendors that may have technology like these. So if we move to the next slide. Great. So free up valuable time for patient care. Again, I think we've talked about that. That's pretty much a very critical theme here. How do we actually streamline a lot of this so you can focus on patients? So we've seen a lot of benefits moving towards a single cloud-based system when it comes to our inventory management solutions. And again, supporting specialty pharmacy, patient assistant programs, infusion centers can ensure that they have what they need when they need it. So again, I know there's a lot of practices that we've worked with that historically has been using, local servers, but moving to a cloud-based solution removes and mitigates the risk of relying on local storage or local networks and really supports the ability to further facilitate integrations with other cloud-based systems and also make sure that you really have the ability to reduce some of those operating costs by moving towards a vendor that has something on the cloud. And nowadays, inventory solutions have a lot of standard integrations with EMRs, PMS systems. A lot of you may already have that in your practices to pull patient schedules, medication order lines. We support many different formats. The goal is, how do we ensure that you are not manually entering the same information again and again from multiple systems? So a lot of the time, this serves to provide capabilities where we can calculate billable waste, and we can really reduce a lot of the work it takes to manage information in multiple areas. And then lastly, I've mentioned this before, but again, seek solutions that really help expedite your current workflows. Solutions that have barcode scanning capabilities really simplify operations. We've seen that happen. It increases accuracy and really overall improves efficiency across the entire process. And you'll start needing this, I think, especially if your practice is growing, if you need scale, if you need to handle more volume of drugs and more patients, because at the end of the day, I think we're all being required to really do more with less. And I feel like we should all get matching tattoos with this phrase, because I think that's the reality of it. How do I do more with less? And I think this is really going to be pivotal in helping you with that strategy. So with that, if we move to the next slide, I talked about one aspect of Cardinal Health's technology suite when it comes to inventory management solutions, but Cardinal Health really is designed to enhance operational and financial performances across infusion centers. We have a comprehensive suite of products that is really tailored to meet each center's needs, with the goal to empower infusion centers to navigate, again, complexities in the healthcare space, but more so for you not to have to be the subject matter experts in every single thing, really making us a true partner that can help provide expertise and tooling, so you can focus on what you do best, which is treating your patients. So many of our products are built in-house, but we also do collaborate with industry-leading partners across various solutions and services. So if anyone is interested in learning more, please reach out to us. We'd be happy to share more information. So with that, I'll move to the next slide. Again, Cardinal Health is deeply committed to the success of infusion centers, and we understand the challenges, and we want to provide more opportunities. So with that, thank you so much for your attention, and thank you again, Brian, for collaborating with us so we can share our thoughts on this topic. And I will actually hand it back to you.
Thanks, Veda. So as we transition to a Q&A, you're encouraged to submit any questions you have by clicking the Q&A button at the bottom of your Zoom window. Questions are submitted anonymously, so don't be shy. There are no bad questions when you're investing in your infusion center's capabilities. So the first question we have is, how can we purchase the NICA standards for our infusion center? Can we go back to slide 8? Thank you. So you can purchase the NICA standards by scanning this QR code, or by going directly to standards.infusioncenteраccreditation.org. Next question is, we are a smaller specialty practice and currently track inventory in our EHR. For a practice of our size, how do we know if we have enough volume to justify a dedicated inventory management solution?
Sure. That's a really great question. And I think it's really an assessment and evaluation of a couple of things. So one, are you struggling with your current workflows to meet the demand for inventory processes? So think about the capabilities that you have in your EHR, probably very simple, very kind of basic, standard, critical functionality. But I think for you, it's really understanding, is the volume of your drugs increasing? Are you starting to see the need to start to need additional hardware accessories to streamline a lot of that processes. Is that EMR really capable of handling some of those additional functionalities, right? Where you need inventory categorization or you need billable waste tracking. Is this something that you need and you're finding challenges to maintain that and keep that up? And or maybe it's very manual and you're saying, hey, I have an entire half a headcount or a headcount doing this on a regular basis. Is it worth, that time for that person? Should that time and effort and really money be spent elsewhere? I think those are the types of questions you'd want to start answering. And really, a lot of it is going to come with the growth and scale of your practice, the number of patients that are increasing, formulary complexities, and then honestly, reimbursement. That's always going to be a big one. And how do you save time there? And maybe investing in a solution will help you with that.
Great, thank you for that. Do you offer a resource for keeping track of where to start to learn about buy and bill process as well as insurance updates in regards to prior authorizations and insurance companies that don't require them?
Yeah, that's a great question. I think it's definitely a resource that we can help with. I know probably one of the biggest challenges is payer policies change all the time, and there's no real way to track it. And you basically have to go to every payer portal to access those policy changes as well. So we are working on a couple of solutions that really are focused on how do we provide more transparency and visibility into payer changes. But also what we're looking at doing is really supporting a lot of these questions by understanding, hey, with these payer policy changes, whether it's buy and bill or some other guidelines, is there a centralized location that we can provide digitally? I think right now a lot of our resources are provided based on when we are able to access that information or those changes as well. But we are doing a lot of work on trying to figure out how do we optimize and automatically understand and be alerted to those guideline changes. But I do think as an inventory solution, there are definitely solutions that have integrations or have updates where you're using a particular really kind of an understanding of what your payer mix is, what your patient population is, and you can start to get some information there. Happy to provide more details on what that looks like, but I don't think every inventory solution does this, but it seems to be the top of mind for every technology player in the market to figure out how to be more on top of those payer policy changes before, and really how do you connect that back into your dispensing systems or your EMR systems.
Great, thank you for that. So going back to the question about tracking inventory in our EHR, what about infusion centers, like ambulatory infusion centers that don't utilize an EHR? What types of systems does your solution integrate into?
Yeah, that's a great question. So typically I would say if there is an integration with an EHR, a lot of things are simpler, but we actually have an inventory management solution where you don't necessarily need an EHR to manage your inventory. Now, again, really it comes down to if we wanted to have your patient list, if we wanted to see schedules, if we wanted to see medication order lines associated to future schedules and appointments, where do those live? A lot of the time we evaluate, is there an integration we can do with any systems you have, regardless of whether it is an EHR, where we can support those needs. But you could also actually use our inventory system as a standalone option, and then figure out how that could be incorporated in your workflow today. So again, I don't think it's an absolute need. I think there's a lot of benefits to having an inventory solution without even an integration into your EHR, but definitely I think it helps a lot if there's some integrations where you keep appointments or patients or medication order lines, because that is really where that dual manual entry comes into play. So definitely options there, definitely something we can support, but would love to understand what that workflow is to help you out.
Great. So it's time for a question that I'm assuming everybody is asking. Cost. what is the typical cost of implementing, in general, an infusion inventory management solution, but in particular, a Cardinal solution? What kind of costs are we looking at there?
Yeah, it's a hard question to answer because I think the total cost varies a little bit, and I'll talk about some of the factors as to why. I think a lot of the time there are integration costs with EMRs or EHRs where we're pulling information from them. Every vendor is a little bit different. So again, sometimes that contributes to what that cost looks like. Also, a lot of us, Cardinal Health, as a distributor, we definitely try to alleviate some of the costs for our customers, whether it's through kind of rebates or discounts that we could help to ensure that some of this technology is provided and able to help you, knowing that you're a distribution customer. So again, it's hard to say honestly, but I would say the factors you need to look at is what vendor are you actually going with? Who is your partner? Are they able to help you alleviate some of those costs? What integrations do you need? Do you need any for your EHR? Do you need integrations with your PMS system, or can we kind of streamline this and streamline this workflow? But typically, I will say the one thing is the cost almost never is never over kind of the benefit that our practices see with an inventory management system. Even from a maintenance perspective, it's fairly minimal. So to me, I really think that this is an area where that investment is worth it. And definitely, I think Cardinal Health and probably other areas as well are really looking to support minimizing a lot of that cost for our customers.
Which EMR are you most familiar with from an integration perspective?
It's a great question. We actually integrate with any EHR or EMR. So we've integrated with EMRs and EHRs across multiple therapeutic areas. I think we have over 40 to 45 EMRs that we currently integrate with. Doesn't preclude us from integrating with others. We basically facilitate conversations through our technical account management team. We work with EMRs around what specifications are required, what data feeds we need. We work with you and partner, really take away a lot of that ambiguity, and we take that work on. But again, there's not been an EMR that we've not been able to integrate with at this point in time without having those conversations with vendors.
That's excellent. I wanted to jump back to that cost conversation and just make sure the audience is taking away the right information. So in terms of a typical inventory solution, what does the cost structure look like? You mentioned that there is an integration fee. Are there other fees that centers should expect? Is there like a utilization fee? Can you walk us through some of that?
Great question. I think typically there's probably almost like the way that I've seen this in the past, and typically how Cardinal Health looks at it, there could be, very well could be, if you're integrated to EHRs, an integration fee. There could be sometimes a one-time fee depending on what vendor you use for the actual onboarding work. But from that point on, a lot of the time it's not necessarily a subscription model. Really the maintenance of that, and I'm speaking for Cardinal Health, we absorb a lot of that maintenance costs for our distribution customers. But again, depending on whether you partner with a siloed inventory management vendor or a vendor that is kind of a distributor that supports a lot of these products, it could be varied. But I would say one-time fees for onboarding integration costs are probably the most common, and typically maintenance is absorbed by that larger entity.
Great. You mentioned something going into effect later this year. I think it was DSCSA. What is that, and how do infusion centers need to prepare?
That is a really good question. So for those of you, and I have to say this acronym again and again, DSCSA is really, and we actually have requirements around this as well. And we have a resource. If you go to Cardinal Health's website, you'll see some information around it. But DSCSA is really kind of a regulation that is coming up with a couple of primary components. One is verification around kind of the partners that you use from a distribution perspective, as well as a pharmacy perspective. So again, it's called the Drug Supply Chain Security Act, right? And a lot of the time it is focused on ensuring that there is an audit trail and a trackable trace from a manufacturer to a distributor to finally a provider. And when we say kind of a trace for verification, you're verifying not only that your partners that you are procuring drugs for actually have the ability to track products at a very serialized level, but you also have the ability to track that entire process from the manufacturer to distributor to provider. So there's a lot of work that Cardinal Health is doing to support documentation, because once DSCSA is actually enforced, you may be required to provide documentation at that level. But also for providers themselves, one of the critical components is, are you able to track expiration dates? Are you able to track lot numbers and serial numbers for your products? So I think that is going to be the biggest impact in understanding what documentation do your vendors have that will support any audit asks or requests when it comes to this particular act.
Great. So it sounds like, while a paper log type of a process or an Excel spreadsheet may be able to cut it for that ease of mind and sort of, risk mitigation, it sounds like a technology solution is really sort of the path forward to prepare for this DSCSA going into effect.
I think it minimizes a lot of the human error that we're probably facing right now. And again, trackability, right? If someone comes and says, I need to see something from 2 years ago, a paper trail is going to be hard to find, right? So a lot of the benefits of having a digital inventory management solution is historical data, right? It saves a lot of that information for you. And I think that's where that benefit lies.
Great. So centers, make your life easier, manage risk that's coming downstream, and invest in a technology solution. So aside from a security framework to protect patient data, what other questions should infusion centers be asking when considering an inventory management solution?
Yeah, that's a great question. I think one, it's around kind of the key capabilities and functionalities of that inventory solution should be meeting some of your critical problem areas. Is it, I'm doing a lot of dual manual entry in multiple systems. I can't manage that. I'm doing a lot of paper-based processes, or hey, my patient volume has increased and I'm struggling to keep up with it. Maybe your formulary has increased, or even your complexity of your formulary has increased. And a lot of that comes based on your payer mix and your patient population mix. Some preferred formularies are not always in the approved list on your payer. So again, it's how do I manage kind of that complexity? And really the question should be, what does your solution do to support this particular issue? How do I solve this pain point with your solution? So I think a lot of it is going to come from a pain point. Where is the real pain that you are facing when it comes to managing your inventory, and asking that vendor or that partner, how do you alleviate this pain for us? What can you show us? And then lastly, how well does it fit into your workflow, right? Is it a standalone process? Does it integrate really well with what we have today? So evaluating and kind of looking at your entire experience and saying, my clinical staff they receive a box, they have to open it up, they have to stock. Maybe I scan an item here, I put it into a refrigerator or a cabinet, and then I need to dispense it. And how do I do that? And then maybe I need to check temperatures from home. Maybe I need to come back in and do a cycle count on a daily basis. Where does that software, where does that technology solution fit into all of these pathways? I think just assessing what that workflow looks like, and then evaluating, can that technology solution service you correctly? That is going to be the big thing.
Great, thank you. One last question here. I think you touched on some of these pieces, but if you could go ahead and reiterate. Does your solution help us track things other than lot number, serial number, and expiration date? Does your solution help with documentation like treatment notes?
Yeah, great question. So, yes, we definitely track more than those 3 attributes. We track a myriad of things when it comes to the drug itself. And then when we actually dispense a drug to a patient, it tracks a lot of information from that patient. Treatment notes, I'm assuming I could answer this 2 different ways. If it's treatment notes coming from the EMR, no, but maybe the question is more, hey, there's a procedure note at the time of dispensing that I need to type in. So I think that's probably what it is. But again, we can support different functions like that. But I think more so, maybe the question is, do we have the ability to support bi-directional feeds between the EMR and our inventory solution? A lot of the time it's yes. If you need to do something here, it actually syncs back up to your EMR. So again, really with the objective of avoiding dual entry, right? Or manual entry into different systems. Hopefully that answers the question.
Yeah, I think that's great. Eliminating, opportunities to introduce human error is huge, huge here. Okay, well, we're coming short on time. I want to make sure, everybody has an opportunity to answer these 2 poll questions. So thank you for joining our webinar today. If you want to learn more, you can visit cardinalhealth.com/multi-specialty, or you can go to NICA's website at infusioncenter.org to learn more. But in the interim, we'd love to learn a little bit more from you. If you'd like to learn more about Cardinal Health services and solutions, if you would like somebody at Cardinal Health to reach out to you directly following this webinar, go ahead and answer that first poll question. And then secondly, we'd like to understand whether you're a current NICA member or not. And if not, if you would like to learn more about member benefits and how to become a member. So we'll give you a few minutes here to answer those questions. Thank you for your time, but most importantly, want to thank you for all and everything you do to support patient access to much needed care in a cost-effective non-hospital setting. So with that, we'll give you guys a few minutes back in your day. Thank you again for joining this webinar, and stay tuned for subsequent webinars, whether those are clinical education or industry partner solution and service webinars. Thank you again.